Good evening, guys. This discussion tonight has to deal with aging folks and cold temperatures. Perfect for where I live right now because it is bone chilling cold. So we will discuss the effects of cold on aging bodies. Here we go with tonight's discussion C. Here we go. Why dropping temperatures can be dangerous for adults over 50. Cold weather is not just uncomfortable, it can be a serious health hazard for older adults. As temperatures drop, the aging body faces unique physiological challenges and environmental risks that can amplify existing health conditions, increasing vulnerability to accidents and strain systems already working harder with age. How cold affects the aging body. Circulation and blood pressure. Exposure to cold constricts blood vessels, raising blood pressure and forcing the heart to work harder. For adults with hypertension, heart disease, or vascular problems, this can sharply increase the risk of heart attacks, strokes, or other cardiovascular events. Declining thermal regulation. With age, the body becomes less efficient at generating and retaining heat. Older adults may not feel cold as quickly, which delays protective behaviors like adding layers or seeking warmth. This makes hypothermia a dangerous drop in body temperature more likely. Metabolic and cardiac stress. Shivering, a natural response to cold, raises metabolic demand and cardiac workload for someone with limited cardiac reserve. Even mild cold exposure can be taxing. Respiratory strain. Cold air can irritate the lungs, worsening conditions like asthma, COPD, or chronic bronchitis. Breathing in frigid air may trigger coughing, wheezing, or shortness of breath. Common risks in cold weather. Cardiovascular events, sudden spikes in blood pressure or increased cardiac strain can trigger angina, arrhythmias, acute heart attacks, falls and fractures. Ice, snow, and reduced mobility increase the likelihood of slips and falls, Recovery from fractures, especially hip fractures, can be prolonged and complicated in older adults. Exacerbation of chronic conditions, arthritis, pain, and stiffness often worsen in cold weather. While circulation problems like peripheral artery disease can become more pronounced. Immune vulnerability. Cold stress can weaken immune defenses, making older adults more susceptible to seasonal infections, such as influenza or pneumonia. Practical precautions. Dress strategically. Wear multiple layers, thermal socks, gloves, and hats. Indoors, avoid sitting near drafts. Keep feet warm. Maintain a warm environment. Keep living spaces at a safe temperature using space heaters carefully and insulate windows and doors. Limit exposure. Avoid prolonged outdoor activities in freezing conditions. If necessary, schedule errands during warmer daylight hours. Medication awareness. Some medications like beta blockers or diuretics can affect circulation or body temperature regulation. Regular reviews with a healthcare provider are important. Prevent falls. Use non-slip footwear. Clear ice from walkways and install grab bars or railings where needed. Stay socially connected. Isolation increases risk. Regular check-ins from family, neighbors, or caregivers can help detect early signs of cold related illness. Hydration and nutrition. Cold weather can reduce thirst cues, but dehydration worsens circulation. Warm, nutrient-rich meals also support energy and immune function. Key takeaway. For adults over 50, dropping temperatures are more than a seasonal inconvenience. They represent a compound risk factor that interacts with aging physiologically, chronic disease, and environmental hazards. Awareness and protective measures can transform winter from a season of danger into one of safety and reliance or resilience. Would you like me to adapt this into a caregiver friendly checklist or a public education handout? That way, it could serve as a practical tool for families and community programs supporting older adults. Okay, folks. So, I will be on tomorrow afternoon for shows. Until then, Gator Wellness. Take care, folks.